Hi, my name is Evie Ward. I'm 15 years old and a freshman at Wahlert Catholic High School. At 36 weeks gestation, I was diagnosed with a hydrocephalus due to a left intraventricular hemorrhage. My parents chose UnityPoint outpatient services for my post-operative physical and occupational therapy.
The most positive aspect of our current facility is the teamwork that we have. I have a great staff between the therapists, the techs, the front desk, and we all work together as a team. And they communicate very well with the patients and their families, and always keeping the patients at the center of what they do every day.
The one thing I really love about them is they collaborate, they work together, they communicate regularly, working toward the same goal.
Coming to Finley has allowed Catherine to be able to ride a bike. For example, that's one thing that doctors told her she was not going to be able to do. And she loves a challenge. Her therapist has given her those challenges and just pushed Catherine just far enough. And she's been able to do some of those things that people didn't think she was going to be able to do.
They are so good at their respective skills, physical therapy, the occupational therapy, the speech therapy, and they're so dedicated and focus on the child. Like, each child is different, each child is unique, and they really tailor it to each specific child.
Oh, our therapists are like family. They know every little thing about him. They know what he likes, what he doesn't like. They take so much joy in seeing him succeed.
We are so blessed to work with so many amazing kids. It truly is a relationship that we develop with our families.
Yeah, I would say while the therapists are godsends and do amazing work, they're inhibited a little bit by the configuration of this current building.
So as far as space goes, it's the difficult part for us is that for Catherine to start a lot of her therapy, she has to come down the stairs so that way she's not intruding on somebody else's appointment. So the stairs are difficult. Catherine can manage them, but I'm sure that there are some patients that can't go up and down the steps.
So because our space is so limited and we have patients who either cannot travel the stairs or need equipment that is both upstairs and downstairs, what happens is that the techs and the therapists have to spend their downtime between patients carrying things upstairs and downstairs, trying to set up rooms for a specific patient, then tear it down quickly and get ready for the next patient.
Here at our current facility, we treat both adults and our pediatric patients. However, there are also drawbacks to having pediatrics mixed in with adults, and that is because each population brings their own needs to therapy.
Our patients will see, with a new facility, a setting that is set up specifically for pediatric patients in a family-friendly environment. They're going to see the big indoor gym that we have envisioned with all of the crash pads and swings and ladders and slides and fun stuff, and that's just going to get them even more excited for therapy.
These kids need this help. The therapists here need this help. They do excellent work for these kids and their children. And all we're asking is that you give these children a chance.
We need your help. We need your help to make this dream and this vision that we've had for years become a reality for our patients, our families, and our staff.
When my therapy sessions ended, it was a very emotional time for me. I made amazing friends that I was going to miss. It was a great place for me to be, and they inspired me every day. Although I still miss going to see everyone and don't get to see them as often as I wish, I will always be grateful to them and all that they did for me. Thanks, guys. Love you.